Hello friends, I'm Dr. Amit and this video is going to address a very important topic. How do we create a hairline in a hair transplant? So what are the intricacies behind creating a hairline in a hair transplant? So you might have come across various articles or various books which tell you measurements of creating a hairline, and in my career till date in the last 12 years, we've done over 5,000 hair transplants and I have never till date used any measurement at all, and yet I feel measurements have no value when we are doing a hairline. So what criteria do I use? Dear friends, thank you for watching this video. Please like this particular video and subscribe to my channel. This will give access to all the upcoming amazing videos that we are going to put up, and also open up all the other videos that I have posted so far. Hairlines are different in men and women. In women, they don't have temples, so the hairline curves down. In men, we have temples, so the hairline curves up. We always maintain the sanctity of this triangle. So in a man, the hairline has to come and meet this triangle. We cannot break this triangle by making a triangle here. So this triangle here, and the hairline has to meet it here. I have seen some patients who have had bad hair transplants. Their doctor has destroyed this triangle by creating some hair here, and that's a very bad way of doing a hair transplant. So first important thing. Women, of course, like I said, they have a curved pattern, never have sharp lines. Now when we come on to men, sometimes it becomes important as to how low the patient wants it, but a defining criteria for me is we look for small hair which are remnants of hairlines. Secondly, we see where the head is turning. So if I show on my own head, so as the head moves up, at a point it starts to turn back. That is generally where the hairline is, which we sometimes say is equal to about 8 to 8.5 centimeters, or the palm of the patient, starting from this point of the eyebrow. How do we create the designs? So a face which is long or triangular, I always create a V. That's important. It looks very nice because it matches with the V of the face. If a face is more round, then we try to create more round hairlines. A sharp V on a round face looks pathetic. So a V also gives you an opportunity to create a hairline which appears lower, and yet you can go slightly higher and it gives that appearance that the hairline is lower. So we create an illusion. Rounder face, we need to go low all over in order to give that look. Sometimes patients want designer hairline, so we create these triangles like what Mr. Salman Khan has. Those kind of triangles can actually be created. And lastly, in the hairline pattern, what we try to do always is create zigzags. So the hairline, the first line always needs to have small zigzags. Anything straight like this is artificial, it never exists. So I'm sure these pointers would help you plan how your hairline should be done. However, the final decision is always the decision of your surgeon. Please stick to plastic surgeons. One exception to this rules of hairline is people who have very extensive baldness and we don't have that much hair. So we create the hairline higher up. Rather than here, we would go here. Instead of a more normal hairline, we create like a V. The entire hairline is a V. Ask the patient to grow hair long and throw it cover like this. So that is something like what our Prime Minister has. So as they grow it long, they keep it pressed here. It gives the illusion that they actually have more hair than they have. So this is how we would create a hairline at Divine. We are operating out of Delhi, Gurgaon and Mumbai.